Statins are widely prescribed and generally well-tolerated cholesterol-lowering drugs, and they've been hypothesized to have an anti-cancer effect. However, for prostate cancer, epidemiologic evidence linking statins with prostate cancer progression is mixed. And so the objective of our study was to examine the impact of postoperative statin use on risk of prostate cancer recurrence after treatment. We used a retrospective cohort of prostate cancer patients treated with radical prostatectomy called SEARCH. SEARCH is a group of 5 US Veterans Administration medical centers across California and North Carolina. And we used just over 1,100 men for this analysis, and these men had never used statins prior to radical prostatectomy. And the reason we wanted to exclude men who had used statins prior to radical prostatectomy was we wanted to examine the impact of post-treatment statin use on risk of recurrence, as this would have most relevance for clinical practice. So we used a Cox proportional hazards analysis to examine the impact, to examine differences in risk of biochemical recurrence between statin users and non-users. And we adjusted our models for demographic, clinical, and pathologic variables, and we treated postoperative statin use as a time-dependent variable in order to account for varying start dates and duration of statin use during our follow-up period of just over 6 years. What we found was that postoperative statin use was associated with a 36% reduced risk of biochemical recurrence among men who never used statins prior to radical prostatectomy. One limitation of retrospective studies such as these is that treatment allocation is not randomized. So it's possible that our statin users and non-users differed in other ways that we couldn't control for. For example, men prescribed statins might also adopt healthy lifestyle changes, for example, dietary modifications or changes to their exercise, and these may be linked to improved prostate cancer outcomes. However, a key study strength of this analysis was our ability to exclude men who were statin users at the time of treatment. So previous studies which reported null results between statin use and risk of prostate cancer progression mainly examined statin use at the time of treatment. And because statins are so widespread, it is possible that men who were categorized as non-users at the time of treatment became users during the follow-up period. For our study, we excluded all men who were users at the time of treatment and then categorized statin use during the follow-up period, so as to try to avoid this potential source of bias. So in summary, given the widespread use of statins, and it is very important to understand how they may impact prostate cancer recurrence. And our study findings suggest that statins may have a beneficial effect for prostate cancer treatment in addition to their proven role for preventing cardiovascular mortality.